So allow me on behalf of the Human Resource Institute to welcome all the members to our first webinar. The theme for this webinar is really coronavirus in the workplace. What is the strategic role of HR? We've all had the numbers. I think as at yesterday, they were standing at 25.
Yeah.
And we have a role to play within the HR space, especially because health and safety is our purview. We must keep employees healthy, maintain their morale, and oversee remote working. So allow me to welcome Dr. Korir, who will then talk to us about the myths within this virus and what the truths are and what we need to do within the workplace to ensure that our employees are safe and are healthy. So karibu sana, Dr. Mercy.
All right, thank you very much for this opportunity. I'm Dr. Mercy Korir. I'm a medical journalist at the Standard Group. I do TV, I write for print, and I co-host a show on radio because of the season that we are in. And we've been talking a lot about coronavirus, and largely there's been a grave concern about it. There are reasons for people to be anxious, to panic about this coronavirus. And I hope from this discussion, I hope to take about 15 minutes, we'll be able at least to allay some anxiety and have some things clear. So I will sort of try and outline what the coronaviruses are, why COVID-19, what are the concerns, what you can do, and then we can major on Q&A. So now coronaviruses have been around for thousands of years. This is not the first time that we're having a coronavirus. In 2002, 2003, we had the first epidemic that we know of, that was the SARS, and still originated from China. Mid to early, I think about 2014 or thereabout, we had the MERS, which was the Middle East respiratory syndrome, which was in Saudi Arabia from the camels. That is still coronavirus. When people talk about common colds, that is still caused by a coronavirus. And I think here we call them the flus and whatnot. So sometimes it can be a flu or it can be because of a coronavirus. And this one is usually self-limiting in that one will have it and at some point it will end. So it is called a coronavirus because of the way it looks like a crown. And I think if you've seen images of it, that's how it is. Now, COVID-19 is caused by a new strain of coronavirus, which was not previously known. And this one is suspected to have jumped from a bat into the humans, and that is now why we are seeing the current pandemic that we are in, that has affected, I think, all countries. I think there are only now about 2 countries that are yet to report any, and one in Africa, which is Sierra Leone. And I think everyone else is battling with the coronavirus pandemic as it is. So it's presenting symptoms, the cardinal ones, the ones that everyone must remember, not just for yourself and your families, but also for your employees, is a fever. And for people who have children, you realize that children spike fevers very easily. But for an adult to record a fever, it is not your usual everyday thing. So if somebody has a fever of more than 38, then there's a problem. And especially if this person has traveled or has come into contact with somebody who's been confirmed to have coronavirus, then there is a problem there. And that's why you see, I don't know if you have initiated this in your various workplaces, that people are screening using the temperature guns to see if anyone is running a fever, because now that will be an indication that there's a problem. Because for an adult to run a fever, it's not your day-to-day thing. Now, the other thing is a cough. And this would be a dry cough. The people who have seen patients with confirmed COVID and those who've had it, they say it's like a deep cough. For lack of a better term, it's like, they say, ni kama inatoka kwa kifua. It's a really deep, dry cough. Then the other one, and if somebody develops these particular symptoms and there's a problem, is a shortness of breath, when they have difficulty in breathing. Because if somebody has difficulty in breathing, then it means that the infection is lower down in the lungs as opposed to what we call the upper respiratory system. Now, the average time in which somebody would develop these symptoms is about 5 days. And that's why we say the incubation period for this is between 1 and 14 days. But most people have been developing symptoms by like day 5. But that does not exempt somebody from developing symptoms in day 1 or day 14. And that's why you see the insistence of quarantine and isolation is at least for 14 days, in which time if somebody does not develop those symptoms, then they are unlikely to have coronavirus. But if they develop any symptoms within that time, the fever, the cough, or the difficulty in breathing, then they are highly likely to have a symptom. Now, not everyone with a fever, a cough, or difficulty in breathing will have coronavirus. Remember that we are almost getting into a season where colds and flus will be around. So you'll find that the difference between this and the other ones is that for a flu, somebody is likely to have a running nose and a stuffy nose. So they are, just a minute. So they are unlikely to have to have coronavirus if they have a stuffy nose, if they have a runny nose, because it is likely to be any of the other viruses that cause upper respiratory symptoms. The other issue with coronavirus is feeling tired, general malaise, and fatigue, which may be also symptomatic of the other viruses. But the fever, the cough, and the difficulty in breathing are like the cardinal symptoms. Now, the other thing that would point to somebody being suspect of coronavirus is if somebody has in the last 14 days traveled out of the country, but now after the international flights has been suspended, now we'll have to remove that from the list when the 14 days are over. But anyone who has traveled within the last 14 days or within the last 14 days has come into contact with somebody who has traveled, or within the last 14 days has come into contact with somebody who has been confirmed to have coronavirus, then they are likely to, or they will be like the suspects. The other person is if somebody is somebody who develops symptoms and has been taking care of somebody with coronavirus. So these are the people who are high on the list when it comes to suspicion. The cases that we have seen so far in Kenya, we've seen 25 confirmed cases, but from the studies from China and the countries that have gone ahead of us, they say for every confirmed cases, there are likely to be 6 more times in the community, because not everyone will develop symptoms. Some people just develop maybe a mild cough, and after some time, the immune system is able to fight it. So you may not really be able to pick each and every one. So the cases that we are talking about, the 25, are those that have been confirmed by the laboratory that they have confirmed cases. Now, the thing to note about this, so far, the mortality or the people who died is between 2 to 4% of the people who have suffered from this. And now this may be important for HR managers, because you have to now, when you're thinking about what to do for your employees and who should go home, who should work from home, anyone who is vulnerable, and vulnerable from the community aspect is anyone above the age of 60 years. They've been shown to really suffer a lot more from coronavirus. Anyone with a pre-existing condition, and this is a list that you should have as HR practitioners, because these are the people with diabetes, people with hypertension, somebody undergoing treatment for cancer, people with chronic chest conditions like asthma. We've seen also smokers have not been able to really survive the coronavirus well. Somebody who has had an organ transplant and are on immunosuppressants. So if there's anyone who's had a kidney transplant, for example, they're on immunosuppressants and therefore the immune system is weak. Those are vulnerable. There are people who are on steroid treatment for whatever condition. Those are people at risk. And any other condition, really pre-existing condition, including HIV, those are your at most risk employees who should not be interacting with people at all. And I've seen even doctors who fall in this category have actually stayed home since this coronavirus pandemic was declared. So that is an important point to note. 90 96 to 98% of people who get coronavirus are likely to survive. But we do not want to take a chance, because now this has been in Europe. We don't know how this virus will behave when it comes into Africa, but a good majority of people are surviving and are responding. Currently, we have almost every country in the world affected. Now, why is this coronavirus a concern? Why is it important? One, the signs and symptoms of it are, if you've taken note, fever, cough, difficulty in breathing, it could be any respiratory condition. So you may not really pick it up, but now we are high alert that it could be this, because now we don't know who has imported it, or if anyone has imported, who it is that they've interacted with. So it could affect anyone and everyone, from top management to the support staff at the lower level. So everyone is affected. Two, previously we were concerned because we did not have the capacity to test for COVID-19, but you're all aware that there are some donation of testing kits that were made into the country. So at least now we have capacity to test. But even with this capacity, we'll not be able to test everyone as a country, because now we got 20,000 test kits. And you can imagine we are a country of 47 million plus Kenyans. So not everyone will be able to test for coronavirus if they develop any symptoms. So this is a point to note. So if we can avoid and prevent getting this coronavirus, then it's better than having now to scramble for the meager resources that we have. Two, or rather, I think that's number four, we do not have any treatment for it. There's no vaccine for it. I know a lot has been going around about hydroxychloroquine and chloroquine. People are buying Crest off the shelves because they think it's treatment for coronavirus or it's a prophylaxis. People are looking for ARVs. People are looking for some antibiotics. There is no treatment currently for coronavirus, and there is no vaccine. The best option is to avoid getting it. And this is why there's insistence of maintaining social distancing or physical distancing, which is 1 meter. There's insistence of maintaining hygiene, disinfect all surfaces, wash your hands as much as possible, sanitize if you don't have access if you don't have ready access to running water and soap, sanitize. So these are the best ways of keeping afloat with this current pandemic. Now, the reason for the 1 meter minimum social distancing or physical distancing is because the virus is spread from respiratory droplets. When you cough or you sneeze, you let out particles of the virus that if they land on a surface, like on a steel surface or plastic surface, studies have shown it stays for like up to 72 hours. So that's why the insistence of cleaning and maintaining hygiene. If you cough into your hands, for example, and you don't wash, or you sneeze into your hands and you don't wash, then chances are you may touch a surface and leave the virus. Somebody else may touch it and then transfer it to themselves if they touch their eyes, their nose, or their mouth. That's why we are advised not to touch our faces as much as possible. I know it's a bit difficult because you touch your face unconsciously, and it's difficult for you to remember, don't touch my face. So these are some of the things to consider, and that's why hygiene is very critical. Now, the 1 meter distance is just to reduce the chances of having these droplets move from yourself to the next person. Because if the distance is more than 1 meter, then they'll drop somewhere halfway and minimize transmission from person to person. Now, as of yesterday, there was news that it is airborne. It is not airborne. It is passed from these droplets that move from person to person or when they get onto surfaces. So you do not expect that it is lingering around somewhere in the air and you may get it. Now, the other big concern about COVID-19 is on the socio-economic impact. Obviously, as organizations, when you're thinking about your staff working from home, you're obviously thinking about their productivity and their output thereof. You're also thinking about if somebody cannot absolutely work from home, are you still going to foot, or are you still going to maintain them and pay up? So these are some of the things that we are thinking about. So from an organizational perspective, these are some of the concerns that you have. from individual perspectives, even you yourselves, you're thinking about if, for example, you take a pay cut, are you able to sustain? Are you able to live through it? If you're on lockdown and you're at home, are you able to sustain that? Are you able to get your daily supplies and things like that? So it has presented us with a situation where now we have to think about everything, not just from a health perspective, but from an socio-economic perspective. Because now if people have lost income, you're thinking about reduced spending, and which has a ripple effect on anyone on the supply chain. If you're thinking about lost income, then people are not liquid. So there's a lot of socio-economic considerations to have. Now, the risk currently in the country, I think every part of the country is on high alert, but there are 14 main counties, and if you allow me to just retrieve that are at highest risk because of the nature of these counties. And these are the counties with ports of entry. These are Nairobi, Mombasa, Kisumu, Kiambu, Uasin Gishu, Kajiado, Machakos, Busia, Nakuru, Garissa, Kilifi, and Migori. And this is because of the nature of these counties, that they are at border points or they are international points of entry. So if you're looking at your workforce, then you're also looking at their geographical distribution, their geographical location, and what risks they pose to you as an organization, wherever it is they are. Is it best for them to continue working or work from home, or what are the measures that you put in place to safeguard your employees and also the organization in the long run? Now, what can you do? What can we do? And this is now a call for everyone from an individual perspective and also from an organizational perspective. One is that we should clean hands regularly with soap and running water. Running water does not necessarily have to be a tap. It could be, as long as people don't reuse the water in the same basin or in the same container to wash their hands, as long as water is running. And since patient zero was declared, I think we've seen measures being put in place, people improvising things here and there to be able to get running water. In the absence of that, then there are sanitizers. And a good sanitizer has, at the very minimum, 70% alcohol concentration. But I've seen in some countries they are saying 60%. But for our case here, 70% alcohol concentration is advisable. And these ones are in the market. And as of yesterday, KEBS had said there are some sanitizers they had pulled off the shelves because they did not meet the minimum requirements. So that's now what we need to do from an individual perspective. Clean surfaces regularly. And this is not just at home, but also at the workplaces. And the best thing to use to clean or disinfect surfaces is bleach. Any brand of bleach, you mix 1 part of that and 6 parts of water. That makes a good formulation that will disinfect surfaces. So those organizations that have contracted or subcontracted people to do the cleaning, this should be the instruction, so that the chlorine in the bleach would deactivate any virus that is lying around. So this is an easy way to keep your work spaces clean and hygienic, and also the same that you can do even at home to keep your work spaces, your home spaces clean. And the cleaning is like in a workplace should be including the doorknobs, the door handles, some of the window frames, the staircase rails, any surface that is likely to have a lot of hands on it, and this should be cleaned regularly. The other thing is to restrict travel as much as possible. If one of your employees doesn't need to move from point A to point B, then they don't need to, they can stay put in one place. So, but if they need to move, then you may have to consider or think about how to have them move as safely as possible. And this is not just all employees, even yourselves as managers, because managers may not have the luxury of working at home. You may be called in from time to time. So do you organize charter transport that will get all your employees together so that you can minimize their risk of interacting with other people in public transport, what do you do? So these are some of the considerations. If they don't need to move, then you can ban travel, unnecessary travel, as much as possible. The other one is to observe cough etiquette. And you've seen even from WHO advising people to cough into their elbows, because when you cough into your elbow, you are unlikely, or rather your face is unlikely to come into contact with your elbow at some point during your movement, going about their movement. But if you have to cough into your hands or sneeze into your hands, then use a disposable piece of tissue and you dispose it in a dustbin with a lid or something with a lid, because you don't want these viruses coming into contact with any other surfaces. So they have to be disposed of in somewhere where you can close it up and avoid anyone else coming into contact with this. Now, I've been just wondering to myself out loud, if you are coughing into our elbows, then why are we greeting each other with our elbows? So I'd rather just people wave if you must greet other people. Avoid hugs, obviously. Wave from afar, keep the 1 meter distance, so that the issue of greeting each other with an elbow does not arise, because you'll just be waving from afar. If unwell, or if anyone falls sick, then the first thing is to quarantine. And we say quarantine because quarantine is for somebody who's been exposed or somebody who you suspect to have contracted the virus. So quarantine. So you may want to think about having a specific room in the organization where if anyone falls ill, they can be held there temporarily as you take the other measures. So the first thing is quarantine these particular individuals, get a list of the contacts of this particular person, and this is something they can even list themselves, who have they met within the last 7 days, for example. And this one is usually a very difficult one, because you may not remember everyone that you have met, especially if they are not in your day-to-day circles. If it's in the office, it's easy to trace and say, because you know you sit next to so and so, people you may know. But out in the public, you may not be able to know everyone you meet. For example, if you go to the supermarket, you don't know the people who have also gone there. But the important part is to list as many contacts as possible of people you know that you have interacted with, or that this person has interacted with. The next thing is to call for medical attention. Now, the 719 number given by the Ministry of Health, I'm told, is overwhelmed. So we probably need to look for a plan B. And this, I know most organizations have contact either with a clinic or with a hospital that they have an arrangement with. So it's actually even good to have a direct link now, so that you have a direct call to any medical facility, any hospital, or any clinic, so that they can advise based on the circumstances on the best way forward. Do they come for this person, or do you organize for an ambulance to take this person to an isolation center? So these are some of the things, but the best is to call a medical doctor or one of the clinics that you liaise with. Sometimes not everyone needs to go to hospital for isolation. So these are some of the things, depending on how somebody presents, these are some of the advices that you will get from the doctor or from the medical facility that you get in touch with. The other thing to note is anytime you have anyone who is suspected, or if you have an employee who's been confirmed, it is important to volunteer this information to the healthcare personnel or the hospital that you are talking to. Remember that our healthcare personnel are few in number. The resources are few. You don't want to expose the healthcare personnel to coronavirus, because these are the same people who need to attend to the next person who will come in. And the next person may not necessarily have coronavirus. Remember, this virus comes amidst other problems. We still have HIV. We still have people with hypertension and diabetes complicating. We still have people with cancer who need to go for their chemotherapy. So work in the healthcare space is still going on. So it's important to volunteer this information so that, one, they can be fast-tracked to the right place, and they can be attended to in the right manner as soon as possible, with minimum risk to anyone else who is not a healthcare worker, and more so with minimum risk to anyone who is a healthcare professional. The other thing is to minimize anxiety and stress because of all the fake news and all the misinformation that is coming in. And we've seen that the WHO has a business WhatsApp account that you can actually engage the WhatsApp bot, and it gives the verified information. Some of this information is actually the one that I'm giving you right now. The Ministry of Health in Kenya also has a WhatsApp bot that you can engage, and it will give you the information as to the measures that the government is putting in, what you need to know about it, the signs and symptoms, treatment, the updates. So it's already there. So anyone with a smartphone can access this information. And if it's not in any of these valid sites or sources, then that's information to actually treat with a pinch of salt. And I say this borrowing from the experience that we've seen in Lagos in Nigeria, where now the hospital is working to keep people alive who got chloroquine poisoning because somebody said that chloroquine is a cure for coronavirus. So we want to avoid such kind of information as much as possible. The other thing that people have been asking is whether do we stock up or whatnot. Right now, the situation we are in is fluid. So it's just important to plan even for your own households and for your own employees. If they can stock up what they need, let's say for the next 1 week, then it's best. And the reason for this is not because times may get tough, but mainly just so that we are not always going to a shopping mall, to a supermarket, to the market, so that we try also in our own small spaces, reduce the number of people that need to go out there, because we know going out to get supplies is an important point, or is an important part of our day-to-day living. So, but if people can do maybe for a week, today, somebody else will go tomorrow, then we minimize the number of people that need to be going out, and we minimize the number of contacts that we can get. So what happens if your organization, for example, has a case? Have an isolation or a quarantine space, and inform the authorities as soon as possible. Inform your clients, your customers about what is happening in the organization. Not necessarily that you have a suspected case, because people may stop coming, but you are scaling down on business because of coronavirus pandemic, and people will understand, because everyone is expecting that times will be tough. So it's also important to communicate to your staff about the plans that you have, to communicate to your customers about it. And if you're closed down, then to be good to communicate to the customers and the staff about the recovery measures that you're taking, like decontamination and what you're doing, so that you can assure your staff and your customers when they come back to the organization that everything is safe and they are not at risk. And I think that's the end of my presentation. And I think I've been mentioning, yes, the other one was what can we all do? And I've been mentioning bits and pieces about this along the way. So I'll open up to questions, and Rose was taking up the questions as we went along, so that now she can raise some of the questions, and if anyone wants to voice their questions, we can always attend to that. So Rose.
All right, the question around, please repeat that that will go to the
okay,
right.
Rose, you are not clear. Just repeat that again. We can't hear you. And I think actually everyone can't hear you.
Can you hear?
No, I think as we can't, I think it's your connection. But I think somebody is asking, somebody, this is, I think, Rose, your audio is bad, but let me pick the ones that are already here. Alice is asking about the 14 counties on high alert on the chat box. I think I'll share this with Rose so that she can share with all of you which the 14 counties are, but allow me to just repeat. These are the counties with ports of entry like JKIA, Mombasa, Eldoret. So these are Nairobi, Mombasa, Kisumu, Kiambu. Kiambu, Kajiado, and Machakos is because they are in the Nairobi metropolitan area. Uasin Gishu, that is in Eldoret. Busia because of the port. Nakuru being a cosmopolitan area. Garissa, Wajir because of they're like a port of entry. Kilifi and Migori. Migori because of the port on that side. So those are the 14 counties that the Ministry of Health has indicated as high-risk areas. Caleb, you're asking about, can the virus be passed on to another person during the incubation period of between 1 and 14 days? Yes, it can. We say yes, it can because there's been no evidence otherwise. From what we've seen in China, Italy, Spain, Germany, the countries that have been hard hit, people who are asymptomatic, people who are within that 14-day period and have no symptoms, have been shown to be unlikely to pass the virus. So we don't want to say it cannot be spread at that time because we do not have evidence to say otherwise. And the thinking around this is if somebody does not have a cough, for example, there are no droplets to let out and infect the other person. But the information or the official information right now is because we do not know if this is possible or not, then we are not able to say, for example, that it cannot be passed. So within those 14 days, whether you know somebody who has it or not, then it is important to keep those basic bare minimums of hand hygiene and keeping the surfaces clean. Stephen, yes, we are recording this webinar. So I think it can be shared or you can listen to it later on. Terry Shundu, I've repeated the counties again and I'll send them to Rose so that she can share with you. Susan, you're saying doctors are exposed. Where are they quarantining? Back to their homes? Can they quarantine in the hospitals or select hotels? Will they quarantine for 14 days? So yes, any healthcare worker, and it's not just doctors, they have to quarantine for 14 days. Remember that where you are, even as Susan, as Mercy here, or as Rose, you are a human being first, and everyone is at risk. So the moment you have been exposed, then your titles become null and void. We've seen Angela Merkel, the Vice Chancellor of Germany, in quarantine. So once you are exposed, your title ceases to hold and you become a human being, so you have to be quarantined. So the best place to quarantine for anyone, and even for somebody who is sick, is at home. And we say home because you'll be in a comfortable environment. You'll be able to, remember, quarantine is not easy because you come from being busy to doing nothing. So psychologically, it's not easy. So if somebody is at home, then it's advisable that if they can be in their own room, preferably a self-contained room, and have one person in the household attending to them so that you minimize chances of spread to the entire household, then it's best. Quarantining them in hospitals where also other patients need to be there may be a logistical challenge to the hospitals, but this is something that can be arranged locally between the facilities. So yes, all healthcare workers are exposed. And that's why our duty as the public is to declare our status as soon as we are going to hospital. Whether you've been confirmed or you suspect or you have symptoms, it is good to declare so that you do not expose them. And so you reduce the chances of them being in quarantine and therefore not able to attend to people. And you also take care of their families, because if they need to go into quarantine, then they have to go back to their home or back to their families. Alice, once an individual gets infected with the virus and is treated, are they still at risk of getting it again? This is a very important question, and it has been asked everywhere. Even the WHO has been grappling with this. This is a new virus. We don't really know much about it. And so being a respiratory virus, and what we've seen from other common colds is once you get it, it does not mean you're immune to it. But this being a new virus, there is no evidence, or there's no proof yet that somebody gets immunity once they get it. So that's why until the pandemic is over globally, we are all still at risk. So chances are you can still get it back, but we don't know yet. So we are all at risk. So until it is declared over, we have to keep safe at all times. Edith, you're asking if staff who are pregnant are at risk or vulnerable. Everyone is. Luckily, as of yesterday, the WHO is saying that women who've been pregnant have not been seen to transfer the virus to their unborn children. But now we've seen, or we have confirmation that the virus has mutated. The one that was in China is not necessarily the one that is already in Kenya, for example. So we do not know. So it is better to err in the side of caution other than risk anyone who is pregnant, because we do not know if they can transfer it. And then remember, pregnancy in itself is a state of stress to the body. So we don't know if the virus will have an effect on the pregnant mother. So it is good to just err in the side of caution and categorize this particular group of employees or people as people who are at high risk. The other question in quick follow-up or quick succession to this one is about children. Luckily, children have not been suffering as much as the older population. Globally, there's been a report of one child who's died from the coronavirus, COVID-19, but this does not exempt children. But the data so far is that children have not been affected as much as the group of people that we've talked about. So, but it's always good to be safe and apply all these safety measures to everyone. What is the likelihood, Pamela, you're asking about getting a false negative test? Yesterday on Monday, I was privileged to go to Cambridge and actually see the process of the testing. And because of the implications of it, chances are very low that you'll get a false negative, because what they do when a test is inconclusive or is not showing clear results, they repeat it. Because you can imagine if a test is given as negative and yet it is positive, then that has a very, very significant public health implications, because it means you can clear somebody who is positive to go and mingle back in the community and they may reinfect everyone. So they're taking extra precaution, and I've seen this for myself, luckily, to make sure that when they declare a test negative, it is actually negative. And when it is positive, it is actually positive. So those getting a false negative at this point is highly, highly unlikely, because of the measures that they are putting in place to make sure that they give the correct results. I've answered the question about the droplets in the air. Does the virus die if exposed to high temperatures? Caleb, you're asking. Yes, this virus at temperatures, I think last I checked was above 60, then it will die. But remember that our bodies are at about 37 degrees Celsius, so it will thrive in our bodies. Your ambient room temperature, for example, is about 25 degrees. Outside is about at most 30 degrees, depending on where you are. So this virus will exist in the environment. So the issue about this virus not being able to thrive in an African setting or in a warm climate, I think that myth has been busted, because we see now our people actually have fallen unwell or have fallen sick. Allow me, because I've seen Santrin Devan asking to authenticate the malaria chloroquine has some effect. Chloroquine, hydroxychloroquine, any antimalarial so far does not have effect on the virus. Now, this particular issue came up because in France, they gave 20 patients hydroxychloroquine. when they were managing during this pandemic. And out of this, the 20 were seen that their viral load, the coronavirus load, reduced. So they were asking, could this hydroxychloroquine have any effect on this particular infection? So that is where all this came from. So you can see a study sample of 20 people is not significant to advise an entire population. And WHO currently, they initiated or started what they call a solidarity trial, where they're looking at this hydroxychloroquine, if it will have any effect. So that is still work in progress. They looked at some antiviral called remdesivir to look at its effect. The other one they looked at was an ARV called Kaletra, lopinavir, ritonavir, to see if it has any effect on this particular virus. And the other drug they're looking at is this particular Kaletra, lopinavir, ritonavir, added with what they call beta interferon, if it will have any effect on the virus. So these are still studies that are going on. 10 countries so far had signed up. South Africa, the closest by, was also part of this trial. So currently, chloroquine, any antimalarial, any medicine does not have any effect. Probably the one that can work or that can assist anyone is paracetamol because of temperature, controlling fever. Then Winnie, you're asking leave and work, how do we manage? So let me borrow from examples of some of the places that I've been able to interact with. And what they have done is employees who are scheduled to go on leave now can go on leave. Those that can go on leave are allowed to go on leave. Those that can work from home, work from home. And the whole point of this is to minimize the number of employees that will be congregated in any one particular place. So that is the whole point. So you will have to now sit down as HR and the entire management to see what you can do for your organizations so that work can continue going on if it is possible, and to make sure that you have some sort of business continuity plan and now a business recovery plan, because from the look of things, we are heading into tougher times with government measures that are said to might get more stringent, like what you've seen in Rwanda. Is Dettol effective? This is Mumbingunjiri. Is Dettol effective for cleaning surfaces in this case? Yes, Dettol is a disinfectant. And I think if you've seen at the package of Dettol, it's actually effective against coronavirus. Anything that can disinfect is okay, but Dettol may not be something that everyone can easily access or can afford. That's why the Ministry of Health itself is recommending that bleach, because it's cheap, it's not as expensive as these other disinfectants. And when you mix it with water, then it is a potent disinfectant that anyone can use, whether it is in the office space, so it is manageable, it's economic, or even if it's at home. Michael Isanda, what are the legal implications or considerations when compelling employees to physically attend work during a pandemic? So the legal implications, I think, here will come in if there is a shutdown. Remember, the government has asked employers to scale down, not directly, but from the measures that are there, the employers have been asked to scale down. So you work within the government measures that are in place, because that's what now protects you. The other legal documents you can look at is the International Health Regulations of 2005, because now that is what now the government is borrowing from to enforce some of these particular measures to control the pandemic. The other one is the Public Health Act in Kenya, because now that is now what will be enforceable here locally. So it is a matter of looking at what you as an organization can do versus the measures that government has put in place. If the government, for example, declares a total lockdown, then it is only essential services that will be on. And those are the employees that will be required to go to work. So these are some of the things that as management, as HR practitioners, you need to think about and consider in planning on who can come to work and who can work from home, because now this, when there's a public health emergency, then everything else becomes plays second fiddle to all of these things. Dorcas, about the duration the virus stays in various items. So we said it's from a few hours in certain surfaces. I think like wood is about 3 hours to 72 hours in plastic and steel surfaces. So this is a study that was recent, I think it was last week, done in the US. So I think here the duration is not really as critical, because you have to maintain surfaces clean and disinfected as much as possible. So the duration in which they last on surfaces should not be as material as the actual work of cleaning and maintaining cleanliness in the surfaces. Can the surfaces be cleaned with methylated spirit? So from the data that we have, Beryl, methylated spirits, I cannot conclusively or confidently say it has any effect on the virus, because now at this point in time, we are all relying on what has been proven to work. And that's bleach, because it contains chlorine, or sanitizer with a minimum 70% alcohol, or soap and water. And the reason soap and water works is because the virus has a fatty surface, which the soap breaks down. So your first line of defense is soap and water, bleach for surfaces mixed with water, and then sanitizer as a third line of defense. So for methylated spirits and all of these other things that people are talking about, I would advise that we keep away from them and just let's stick to what has been proven to work over many years. Godric, you're talking about, it's a big challenge for supermarket staff meeting customers whom they are not sure of their status. Hygiene improvement is critical. What would be your guidance in addition to hygiene and reducing congestion? I think this is now where we're saying you may have to screen at your points of entry. Yesterday I was in a supermarket, nobody took my temperature. So maybe you may have to initiate those measures. The supermarket I was in kept reminding customers to keep distance. I had put in places where people could stand. So these are some of the measures that you could keep in place, because I think when there's a total lockdown, probably the supermarkets are some of the places that would be essential services, because people will still need to do their daily supplies and replenishments. But the other measures of what you do if one of your employees falls sick will kick in. So somebody is asking Jik over Dettol. For economic purposes, obviously Jik or any bleach will be cheaper, because here we don't know how long we will be in this state. So Jik for economic purposes or any bleach would be cheaper than having Dettol. But if you can afford Dettol, why not? Is it possible for one to test positive again after healing? If they get reinfected, yes. Are there any cases of reinfection after a patient has healed? I think they were looking at China. I'll have to confirm that. But I think there were cases, because WHO was not really categorical on that no one can get reinfected after healing. But these are still work in progress. These are still things that people are looking at. So that's why for us here, I think it is better to be safe than sorry. When employees self-quarantine, is it treated as sick off, annual leave, or otherwise? This is a Petronila Munyao. This is interesting. I've actually not come across this question, but I think now you'll have to look at your own internal HR policies or what you decide as an organization. Being that it is 14 days, then those are 10 working days. As an organization, you may want to now think about it and decide internally, do you treat it as sick off, or do you remove it from an employee's annual leave? Quite frankly, I do not have an answer for that, Petronila. So I'll have to consult on that, maybe liaise with Rose later after consulting, and then maybe advise on that. The issue of methylated spirit and glycerin, let's leave it out. Let's just use what has been proven to work. Kindly advise, apart from government facility, oh yes, yeah, I got this question earlier today. So your best facility to go to actually in this case is a government facilities. There's some private facilities that have set up isolation rooms for people. But remember, if you look at what has happened in Italy, in Germany, Spain, China, they get overwhelmed. So your best place for any employee, for anyone, is a government facility, and more so because treatment here is free. Now, when you go to a private facility, it will come with some cost implications because, pandemic or not, they are still in business. So the best bet, in my opinion, is just to go to a government facility because everything will be taken care of, including the testing, which is free, offered at Cambridge Laboratories and the National Influenza Center. Yes, infections are linked to immunity levels. I think that is why I emphasized on the at-risk the at-risk groups and the vulnerable groups, people with pre-existing conditions and the elderly. How do we manage coming back to work after sending staff home? If we have a lockdown, how do we handle mental health of staff? Now, these are the measures that you have to put in place as organization to have counselors, and we have counselors who've been trained, the nurse counselors particularly, who've been trained to handle people who've been confirmed to have COVID, or even the people who've been isolated. So this may be the time to just have them ready, because this is a very stressful situation for everyone. So it would be good to also have counseling planned in place. If an employee has been sent home on quarantine and they've been cleared after that, they're free to come back to work, but it would be good to talk to the other employees just to reassure them that they are no longer infectious, or they are not infectious anyway. Should staff who are vulnerable stock up on their medication? I would not advise against it. Remember, some of these medication have shelf life, they have an expiry time. So if you stock up, what if they expire before you use them? I don't think so, because they will be part of the people who need essential services. Hospitals and pharmacies will still be open. So you can stock up to what you need maybe in a month or two. Then after that, you can refill as usual, because these are the areas that are essential services that we cannot afford to close down. Yeah, I think time is up. I don't know if, Rose, we can continue with the other questions. There are many. I can see there are 71 pending questions, but I think some of them we have addressed along the way.
Yeah, thank you, Dr. Mercy. Can you hear me?
Yes, I can hear. Well, let me just answer this one. I think this is important, from Stella, about how do we protect our staff that are customer facing. I need to go out to the market as they offer essential services, e.g. food. Gloves, face mask, overalls, and hand sanitizer are a good start. Yes, definitely it is a good start, because those are now your high-risk employees. I know we have not advocated for face masks unless it's somebody who is sick, because now the face mask concentrates everything into the nose, or the nose and mouth area. We have not advocated for it, but now you'll have to weigh depending on the area where the employee is going. If they need a face mask, well and good. Gloves, if they have the luxury of being able to change gloves as often as possible, then it's good. If they're not going to be changing gloves, then that will be a reservoir for pathogens. So it's best if the hands are free, because at least your hands, you can sanitize or you can wash with soap and water. So again, this one now you'll have to now cascade it down and make the decision according to your organizational level and the risk that this employee is exposed to. Isolation centers, every health facility across the country has identified an isolation center. That is why we are advocating for people to go to any public health facility, because they have identified a space or an isolation place where they can have everyone who has been exposed. Our private facilities may not be able to handle the numbers as we see it, because even as we speak, government itself may not be able to handle the numbers if they increase. So the private facilities are even strained some more. So if you can map out the public facilities around your organization and share this with your employees, then it would be a good starting point in case anyone falls sick. That was in response to Sharon. So Rose, the questions are many.
Yes, indeed they are. I can see quite a number touching on business continuity and recovery plans, contractual obligations, during this pandemic, and also connecting the workplace with people and matters productivity as well.
Yeah.
So this is the first of many webinars. We will continue to receive the feedback from members and continue to engage with future webinars as well. So Dr. we want to say a big thank you for taking your time. Very knowledgeable, timely session. And for me, my takeaways from your session are really around avoiding the fake news by going to the sites that you mentioned.
Yeah. I can share them with you. I'll share them with you. You can share with the membership. Because it's just
Absolutely.
a WhatsApp. You just send them a message, and it's the feedback is instant. So it's a good place to start.
So thank you for that information.
Thank you.
So allow me to welcome our chairman, Joseph Onyango. I almost said Dr. Joseph Onyango, so I can see that he's in my prayers. So, Chairman, would you like to give some remarks before we close?
Yeah, I'd like, first of all, to start by thanking Dr. Mercy Korir for this informative session and thanking all attendees. I can see this has had a very big impact. We're having around 305 attendees all listening up. And this, I cannot overemphasize the importance of, what it will have and how it will impact us. Going forward, Rose, I want to also thank you very specially for this, and the Secretariat, the Acting Executive Director, Irene. And I would like to make a special request that I know there's so many questions that need filtering and answering back. And for this reason, I would really want to encourage that we get another session and we segregate the technical aspects of the information we need to know around the technical medical information that HR professionals need to know about Corona, and segment and have yet another webinar, maybe following up very closely on now its implication on HR in our day-to-day work, so that it is very clear what we do not mix the HR aspects, the medical facts that we need to know, and so on and so forth. And therefore, I think immediately after this, as we synthesize the feedback, we are going to reorganize again other 2 or 3 webinars on the same, so that we can get we can be really informed about this. I really, really appreciate the kind of feedback that I'm seeing from HR professionals across the country, and specifically for you, Dr. Mercy Korir. I hope you'll be available in the next one, and Rose, again, you for organizing all this. So in due course, I'd like to tell members that we are here going to, that IHRM really supports this, and we are going to have 2 or 3 more series on the same topic. I thank you.
Thank you. Thank you very much for this opportunity. I'm glad to always come in again and hold another webinar. I'm honored. And I'd like to urge all of you to stay safe. Think of yourself first, because everyone's safety becomes a collective safety as a society. So it starts with me, then all of us. So please stay safe. Please maintain hygiene as much as possible. We have to live through this pandemic and emerge at the other end, so that we can tell this tale and say we survived.
So thank you very much, Dr. Chair, and all the members. We shall see you in the next webinar, hopefully in the coming days. Asanteni sana, keep safe, and God bless.
God bless you. Thank you.